What's up, everybody? Let me try that over again. That almost sounded like medical jargon. That was "What's up, everybody?" It's Kevin and Zane from our PH Ally. Zane and I have just been talking about the fun of medical jargon a little bit and the fun of meetings. We're going to talk about medical jargon today, and we're going to have Zane run us through a little bit of the medical jargon he's run through in the oncology world, how much he loves it. And we'll tell you about technology that can help us get rid of that and actually help our patients rather than confuse them. We're going to hit this reel and we will be right back. Maybe I've got medical jargonitis. I don't know what's going on. Like my tongue is slipping. Maybe it's another cup of coffee is necessary for the day. Zane, what's up, bro? That's so good to see you.
Yeah, man. Good to see you. Well, yeah, things are going good. How about yourself, man?
Things are good. Things are really good. I have some aunts and uncles coming over for a visit, so that'll be really nice. We will talk nothing about the medical world, and it'll be all about what's been going on with their cats and their animals at the house. So that will be a nice reprieve for me to have a nice mind break from that. And so that's always so much fun to get a visit with family that they go, I don't really care, Kevin, what you're doing. As long as life is good for you, then it's good for me. Let's talk about all the other fun things going on. So I will get a break from medical jargon, over this weekend, Zane. What about you, man? What's the latest and greatest in the life of Zane?
Nothing, man. Just relaxing, chilling, Googling a lot of things.
I saw that. Google, which is nice for medical jargonitis because you have to Google everything that comes out of someone's mouth. Have you been in a visit with a patient that you've noticed yourself spew something and went, "What am I doing?" and reeled it back?
100%. So let's back this up. So when I graduated school, after I graduated residency, I went into the oncology world, and I remember the first note I read in oncology, and not just like in while I was practicing. I had written notes before, but it wasn't the same as like, hey, I'm literally the pharmacist. And I took like 10 to 15 minutes to understand what the assessment and plan was, because it was literally just acronyms, like acronym after acronym after acronym after acronym. So it started with, this person's got breast cancer. Okay, I understand that. Breast cancer. Oh, they're getting DDAC. What is DDAC? Followed by what is the PH? I can't even remember the thing. It was like DDAC followed by this thing, which was paclitaxel, Herceptin, and then they just had our rad at this many things. SX was this, and I'm like sitting there. I'm like, what is going on? And then like Googling all these things. Okay, what does DDAC mean? Okay, dose dense AC. It's A stands for dose doxorubicin. I mean, it's because the adriamycin. Yeah, these, and then C is, it's just like, what is going on? Nothing is really matching up. So so that was like my first couple of months in oncology, was literally Googling acronyms. So the point of this is, it's not just the patients that get confused. It's also the other medical professionals. And I think that a lot of us don't admit that openly. I openly admit it. I'm really dumb, so it's really easy for me to openly admit that. I still, till like one of the last days I was like in the hospital, neurology notes would come through. You're in the ICU, you're reading neurology notes, and 90% of it makes zero sense to you. And I'm literally like typing in what all this stuff means. So I think that there is a lot, a lot we can do just with the communication between different professionals. Forget even the patient, because sometimes, if you read something or somebody used the wrong acronym, they thought that you use this acronym, it can turn relatively bad, right? Because the person following you is thinking that this is happening versus something else is happening. And, that's even before the patient level, where I think we are a little bit more, most people are a little bit more cognizant. So like to your point, did I catch myself sometimes? Yes. A lot of times I didn't remember all of the acronyms, so I wasn't really throwing acronym soup at them, just mainly because I didn't remember it too well. I mean, I got to a point where I could read it, and in my head it would make sense, but I couldn't. But there were times where I'm using like big words to describe like side effects, right? So I don't know, I can't even think of anything right now, but like you'd be surprised at, like, even things like hypertension or whatever can go over a patient's head, right? Like, it's
Yeah.
better to just use like high blood pressure, uh, you know, diabetes, that's sugars, right? Like, those things that we take for granted. I mean, there's also a thing. So I would catch myself, like, that was the one thing, nice thing about being face to face. You can kind of see the glazed look on people's faces when you're going through some counseling or just talking to them, and then you kind of have to like step back and be like, okay, let me rephrase that, or let me make sure. Or I would also always do like the teach back method, where I would say, hey, just to make sure that I did my job right, please let me know how you take this medication, or what are the common side effects. And that would usually get a chuckle, like, oh, ha, ha. But I mean, it would take the onus off of them. Like, hey, I understand this is really complicated stuff. I need to make sure that I communicated that to you properly. And that usually worked really well. But in terms of like professional to professional, you're not going to tell a doctor like, hey, stop using stop using jargon or whatever, right? Because that's just the way they speak. It's really easy, it's really fast. But if this is an area where AI could be really helpful, is taking that jargon and converting it into normal, I shouldn't say, yeah, just normal language, right?
Yeah, I totally agree, buddy. I mean, like I said, kind of taking a step back, it goes back for me when I was working in a facility that was the community was primarily Spanish speaking. And me just trying to communicate with them one language to another language was complicated enough, and having the translator there to be able to do so was really helpful. But then when it came to describing medical terms and then breaking those things down, that was so helpful to have someone that had an actual medical translator that was able to not say postherpetic neuralgia. Instead they could break down, like, what does this mean in the disease state or the rash you're experiencing, and what does it mean in terms of the pain and the pain sensations that you could be feeling related to it. And so I think that kind of understanding of just a very simple phrase and what the implications are to the patient and how they should interpret what's being said in a different language is incredibly complex, and leaves someone going, I don't know what to take from that. Like, I don't know what I'm supposed to do with it. And what it ends up doing, interestingly, I saw, I think it was one of your posts the other day of someone saying, you just threw so much jargon at me that I feel offended. And I'm going to take like significant offense to that because you're trying to act like you're smarter than me. But the one thing that's funny about it is sometimes really smart people in one part of the medical world and really smart people on the other side of the medical world, they have no idea what each other are talking about, right? I mean, and that could be ICD code. That could be, what is AO times 3? And we just talked about that in my company the other day. AO times 3.
Alert and oriented.
Alert and oriented times 3. And guess what? There's a times 4 scale. So you could be like, well, which scale are you talking about, of the two? So I feel like the medical jargon goes very deep on almost like a tribal and cultural understanding of what does this mean to me in the circumstance. And so I'm curious, Zane, when it comes to translation, like, let's say we're using AI to translate from English to Spanish. We know that if we have to translate from English to certain types of Spanish, like Spanish spoken in Spain and Spanish spoken in Mexico, there's differences, between the two. Do you think that's also something that we would have to make sure that the translation models were done in a similar fashion in the medical world? Like, is it per hospital? Is it per specialty? What are we talking to really get it right?
I think you'd have to have a standard that you have to follow if you're trying to, especially right now, if you're trying to say like, hey, we're going to just throw machine learning at it, and whatever you guys want, it'll just learn over time. No, that's just not the way it should be. I mean, the majority of acronyms and such are generally standard overall, like especially in the oncology world. Like, all those are standard acronyms. And honestly speaking, if you have a system and an acronym is not switching over, that's like a good thing for like the doctors to see, or the pharmacist or the nursing staff. Be like, okay, why is this not looking right? Like, am I wrong? Am I using the wrong acronym? Because sometimes people are using acronyms that they think that exist, right? There's a bunch of them that exist, but they're not really true acronyms. So that also might help mitigate some of that when people are seeing like, hey, this is not switching over. My note looks really weird. Everything else makes sense. But you would have to start with a structured database where everything's pulling out of, right? So if somebody says DDAC, they type that in, that gets converted into dose dense, doxorubicin cyclophosphamide, right? That way everyone knows, hey, that's what that means, right? If somebody's saying like ERPR, estrogen receptor, progesterone receptor. I mean, I used to talk to like other specialties, and I'd be like, hey man, like I think I was talking to a neurologist one time, and I'm like, yo, I can never understand what you guys are writing or talking about. And he joked with me too, and this is a neurologist saying, yeah, when I'm reading oncology notes, I don't know anything. He's like, I'm literally like have like Google or Up to Date next to me, and I'm just like typing in all these acronyms to figure out what is actually going on. And those are like two specialties where you have that are considered like, you know, top notch, like some of the cream of the crop go there, and they're like struggling with it. So imagine like just a generalist looking at these notes, or your primary care looking at these notes, they're going to be really confused, right? And then add on the amount of time we have to scan through notes, and then you kind of are, you just keep compounding the problem over and over again. And then what happens, and then, you know, everyone's like, well, who cares, like, you know, as long as the patient gets well. What happens is when you don't have a complete understanding of what's going on, then you just regurgitate that jargon, or that what you think that jargon is, to the patient, and you can't really explain it because you don't truly understand it. And then the patient is confused too. So it's like this domino effect that keeps happening just from the top to the bottom. And for me, if we can fix it from the top, then more people will be more understanding of actually what's going on, and then we can explain it better to our patients.
So, like you were saying, it doesn't mean that we have to stop speaking this way as our own like internal thought process. We can still allow neurologists or cardiologists or whoever to use their vernacular, but then it is translated to what is common speech. And some of the things that you and I have seen inside of there, Zane, like I've seen medical terminology simplified. Like there is I think like 7 versions of it. Like that has a book reference to it. I was just looking up and I saw that Michigan has like their own dictionary, like plain language dictionary. I know the FDA has their own breakdown. You and I have both seen some other things to be able to take away from misinterpretation, like tall man letters, which are often used in pharmacy settings to be able to distinguish one medication that may look like the same like letter orientation as another medication to avoid those mismatches. What other things do you think would have to be incorporated into this model for appropriate translation, bud?
I think in the beginning we can just start with just taking common acronyms. And I mean, pharmacy, we have so many acronyms, right? You know, so like, you know, QS, like I remember talking to a technician, and they're like, what does QS to 4 mLs mean, right? And I mean, to us that we've been studying it, whatever, like, oh yeah, you know, just fill it up to 4 mLs. But like, if somebody's just coming brand new, I mean, this person is making medication and they're trying to figure it out, or maybe they're too afraid to look dumb. They're like, oh, do I add 4? I mean, they ask me like, hey, do I add? Does this mean I add 4 more mLs of sterile water? I'm like, no, you just take whatever's left and just drop until 4 mLs, right? I mean, so like just taking those things and just translating them out. And you know, every specialty has their things, and there's dictionaries out there, like you said, that exist. I think to start from there, and then you can kind of move into like other things in general. But you'd have to kind of, I think I would start with like the jargon and the acronyms that all exist, right? Instead of A&O, you can write alert and oriented. You know, one, you know, what is it, BR, bright red blood per rectum. That's one that always comes up randomly, and every time everyone sees it, like, what the hell does this mean? You know, you can just type in the whatever BR, and then it just would show up like that, right? Like, I mean, just things like that. That also just saves people time as they're like reviewing charts and notes, because, you know, surprise, surprise, we're humans too. We don't know everything in medicine. We all know our like little subspecialties, but we can't know everything, every acronym, every this. And then also like common things like neuralgia or whatever. Like,
Yeah.
what does that mean? You know, like what's the difference between, you know, there's like a gazillion ways to describe a rash, right? Like, I mean, there's just so many different things that you have to kind of look and try to figure out what exactly they're talking about.
No, that's a really good point. So when it comes to technology to deploy it, like have you seen some things out there already, Zane, that have been trying to, or have you tried some of the tools that are out there to be able to do medical translation right now?
I have, not to this extent. I've tried, so I tried Azure, so that Azure is Microsoft's cloud services, and I tried to and I wasn't developing, I was helping somebody else develop something where it was kind of translating what you were talking about. It worked relatively well, and this was 2 years ago. I haven't gone back to it, and I know that there are things that exist where it'll replace words. Funny enough, it's something that I want to see if I can look into. Just kind of give it a dictionary, and like say, hey, if these words are in there, just switch it over to this. So more to come on that. It's definitely something I'm looking into, just because I'm interested in it. But I think it would be really helpful in just the day-to-day life of healthcare workers. And then also you have to think about, like, now that things are starting to move outside of the hospital, outside of the clinic, we're doing hospital at home, all these things, and you are having nursing staff or other staff that are not necessarily linked to the hospital, or other things going on, and notes are being transferred here and there. You don't know, and they're dealing with a lot over there. Like, you can't expect them to. It's not like they have a computer with two monitors where they can just like Google everything. No, I mean, the likelihood is reading the note right before they get to the patient's thing, and you don't want to add more confusion to that. So, like, as we keep moving outside of the hospital world and the clinic world, we're going to have to be more and more cognizant of, like, just communication between different practitioners.
Yeah, I think it's really interesting that, like, the implications of some of these things and where they could end up going when it comes to translating individual, like, text, just like you can translate individual concepts to know, like, what does this mean for you? I mean, because looking at hypertension, for example, like, what does hypertension mean to a geriatrician versus what does it mean to a primary care provider versus what does it mean to a cardiologist? Like, we're talking about some different things in terms of what do those numbers mean? What do they mean on the way that they're going to treat this, or how they're going to view it for their individual patient? So I think there's a high level of complexity there. So just taking it all the way down to, if we have these terms, this jargon, or these acronyms, even if it's just an acronym translator of being able to say, this is what this is, and then have a pop-up so that we can read it. I think the most important thing, you just said it. It's the fact that we're going from, all these notes are housed internally, and now we're trying to find ways for more individuals, patients we're talking about, to have access to their own data. Well, it's just the exact same thing, Zane, as when we started to require hospitals to be transparent about their billing services. Come on, man. Like, oh, great. I'm glad that I can now look at all the ICD codes that are not formatted or translated well enough to be able to look at what your internal terms are versus the terms that you're putting out to the public. So the ridiculousness of that information going out, I think it's just kind of one element that showcases how much healthcare does not make sure patients are under a full understanding of what they're getting into, is a medical bill. Like, a medical bill is almost impossible to read. You and I have both spent enough time in a hospital setting that we should be able to pick up anyone's medical bill and tell them exactly what's going on there. I cannot. I've got to look a number of those things up. I've got to look up what's happening in the individual insurance carrier and the reason why they're treating one thing different versus another. And so I think the one great thing about translation is, if someone is going to have access to their medical records and we want them to be able to say, here's a medical encounter, here's the viable information from it, here's what you can take home and utilize for yourself. If we put that in a language that they can't understand, we just defeated the entire purpose of making it accessible in the first place.
Yeah, and that's the big thing, right? And like, how amazing would it be if you're a primary care, or like anything, or you're a pharmacist looking through stuff, and instead of seeing ICD-10 codes, you just get the actual diagnoses, right? I'm not saying that you type in every single diagnosis. You just get, like, this ICD-10 code is, instead of showing the ICD-10 code, because outside of billing, literally no one cares about them. Like, literally no one does. All we're looking for is, what does that ICD-10 code mean, right? And like discharge summaries that are even, like, that are meant to be given to patients and families. Has anyone ever, have you guys, if you ever read one of those, you need some sort of background medical knowledge to understand what is going on, right? Because there's still a lot of jargon in there, and a lot of that has to do with just time, because people, it's much easier to write, it's much easier to write like 3 letters than it is to write 3 words, right? And so, like, that's the thing, like, the best in terms of, like, when you're creating a product, the best products are the ones that people don't really know that are existing. So they can still go on their own workflow, but it's doing everything in the background and changing everything for them. And that to me is like what it should be, right? It's not something that needs to, like, they need to worry about, whatever. Like, yeah, maybe if it's doing some weird translation or it's not that, yeah, you need to catch all that. But that's still much easier than asking them, like, hey, you know what, instead of typing HTN, can you type in high blood pressure?
Mm-hmm.
I wouldn't do that because I wouldn't remember half the times, right? Because that's when we're writing notes and stuff, like, it's we're not going to sit there and type in high blood pressure. We're just typing in HTN, or, nausea, vomiting, NV, diarrhea, this is like, does anyone really know how to spell diarrhea? I have to look it up every time. How do you actually spell diarrhea? So, I mean,
Now that I'm going to clip out of this, and we're going to have on our reels so everybody can listen to that same line over and over again. The genius that comes out of the Zain and Kevin Healthcare Tech Show is right there. Can you spell diarrhea?
I mean, I ask everyone to, without looking it up, just spell diarrhea. Let me know. Let me know if you spelled it right the first time.
I'll put a poll out there. Everybody will plug that in. So without getting too loose with things, I do think that the translation efforts that are happening right now have been done on the opposite side, Zane. Because we already know that to be able to get paid, you have to be able to pull notes together, interpret them, and push them over to CPT, ICD, et cetera, codes, so that now we can push those across to a medical bill. So doing the exact opposite, with all these individual codes to push them back into common language, and then further back, to medical language, and then further back to common language or plain, speech, I think is the next real step for us to reverse engineer that. Any companies or anything that, I mean, I know you're personally kind of looking into how well can we do this and how easy could it be to apply, but have you seen anybody that has done it well thus far in the way they put things together? So for example, for me, there are a few different websites that when you look at how they're breaking things down for you as an individual to understand, like Medline, for example, the Medline Plus, like reading through their articles, they've written them very well for interpretation and view by an individual. Have you seen others that have followed a common kind of suit, or any in the vein of what we're talking about today and translation?
Yeah, and this is gonna bother me, and I cannot remember the name of it. And I used to use that website all the time. So basically, it's it has almost every oncology drug in there, oral, IV, and it breaks it down into very, very simple language. And it was an amazing resource.
Not cancer.org?
Huh?
Not cancer.org?
No, it wasn't cancer.org, but cancer.org also does a really good job of, I think a lot of these, what's nice to see is a lot of these, like not-for-profits, or like, are seeing that, hey, we need to break this down. Like Mayo Clinic also does a really good job. Cancer Clinic, Cleveland Clinic also does a really good job of having like articles that are easy enough to do, to read up on and kind of figure out. Because I think that one of the problems, we can't really complain about patients not seeking our help if they don't understand what we're telling them. Everyone seeks out what they can understand, right? Like when you have a problem, if I'm in a different country, let's say I move to, I don't know, let's say I move to like you, I'm trying to think of a country right now. Let's say I move to Mexico. I know a little bit of Spanish, but I'm not like fluent to it, right? And I'm like, I have a problem at home. Am I going on YouTube and searching for, Spanish tutorials? No, I'm looking for English tutorials, right? It's the same thing. Like is with healthcare, like they're gonna look in a language that they can understand, not just the language, but like how it's written and how it's presented to them. So whatever's the easiest way to listen and the easiest way to understand what they're trying to get to is what they're going to follow. Like, yeah, we can have the greatest articles, we can have all this stuff, but if they do not understand it, we have literally just wasted our time.
It's true. And I think that was the one thing I was trying to get at there, is really, even if we translate a term into high blood pressure, for example, like what is high blood pressure? So I feel like we have to have an additional layer when we have the ability for an individual to go, okay, good, I've broken it down into more plain terms. But even the plain terms, I don't understand what that means to me. Like, what if my blood pressure is high? And so I think now having the technology to break it down, but then also provide references to be able to understand, like, what is this, in very simple terms. and link them out to some of these resources like Medline, for example, and some of the others that you just brought up, I think are another layer to what I would love to see when it comes into this interpretation. You and I see that all the time on websites that maybe there's a new term that we haven't run across before, and you can hover over the top of it and it'll give you a little blurb to kind of describe what that term is talking about. I think that is another layer, that can be put on to simplifying these medical terms for us.
Yeah. So ChemoCare was that website.
Okay.
And yeah, no, and that's like another way of doing it, right? Like if you don't want the note to look too generic or whatever, you can have all the acronyms just be hyperlinks where you just, if somebody doesn't know what that is, they can just hover over it and boom, it just gives them a quick whatever, right? It just gives them that. If they want to know more, you could theoretically, I guess, could make it clickable, and you can pull up a pane and it just kind of describes it more. But yeah, I mean, I think, but like my big thing with this is like, I think we spent so much time on, yes, we need to spend time on the patient and fix our communication with our patient, but it's really hard to do that when we haven't even fixed the communication within our own specialty, between our own specialties. And it's just something that,
got it.
At first I felt like, oh, am I really that dumb? And then the more and more you talk to people, they're like, no, we do the same thing. We're Googling and this and that. So you're spending, not only are you reading a note, you're busy, then you're spending like 5 to 10 minutes trying to figure out what that note is saying. And then, so like those 5 to 10 minutes over 40 to 50 patients in a day are going to add up. And then that's less time you can spend with your patient, right? Because now instead of spending 10 minutes with them, now you can really only spend 5, 6, 2, 3 minutes with them. There's a huge domino effect with all this. Like people might be saying this is not really that big of a problem. It really is. Just people just don't admit it, because obviously if somebody says hey, I don't really understand this note, they're gonna, there's this perception that, hey, they're gonna be looked down on or whatever. And I mean, I felt that too. It was very hard. I mean, it took me a while. It wasn't until I started understanding the oncology notes is when I said I couldn't understand it when I first started, right? So it was only until I felt secure enough in my knowledge to where I could admit it. So yeah,
makes sense. Makes a ton of sense. And you're right. That ripple effect. I remember reading, I can't remember which book it is, Innovator's Dilemma, maybe, but it was starting to look at how little things. So this example was how many millions of dollars a travel company was losing because their website was difficult to navigate. And so they had a call center that was having thousands and thousands of calls just because they needed to move a couple buttons and make it a little more logical for someone to follow to get the information they needed. And so until they started to do a study to show, hey, this is taking actually a lot of time and a lot of resources away from us, they didn't realize how impactful it was. And I can't agree with you more, Zane, that I think that a lot of that translation, I mean, getting the information in the first place can be something difficult. But then if you get that information to be able to translate it, use it, interpret it, and then synthesize, what the next steps are going to be, it is a lot of burden, for the healthcare system in general. So having some internal cues to be able to do so, I think would be massive in terms of time. I have no idea what that would be. We can do a study here sometime soon when we get a huge grant. But until then, it's a burden that we need to take care of.
Yeah, and maybe it's just me. Maybe, like I said, I'm not the sharpest tool in the shed. Maybe it was just me and that neurologist I was talking to.
It's just the folks that can't spell diarrhea. I mean, I think that's what my lesson is.
Okay, spell diarrhea right now.
Diarrhea.
I don't even know if that's right because I don't know.
I'm not sure if it is either. That's what is top of my head. So we can have someone fact check us real quick, which we're going to do with Mr. Google here. And it looks
I think you're right. Diarrhea. All right, cool. It's that A that gets me. That H that gets me every time.
It shouldn't be there. I mean, I know a lot of people that think that there's lots of things in the English language that we could fix someday, but that's a little bit too big for the healthcare tech show. We'll just stick to healthcare technology for now. All right, everybody. Thanks so much for joining us. Hope you grabbed a couple tidbits away from the importance of actually us translating all these medical jargon, if that's for our colleagues, if that's for our patients, and the efforts and the meaningfulness of doing so. Zane, the only other thing that we have to drop before we go is we've got a fun soiree happening next week where Zane and Brian and myself are all talking about really exciting things happening inside of the pharmacy world. It is the 18th through the 20th, 6 p.m. to 9:30 Eastern time. And so we're going to have a ton of fun. I think there's 20 some speakers, Zane. They're all going to be there and talking about their individual specialties. So that will be a blast and hope you guys can join us.
Yeah, no, should be awesome.
All right. Well, everybody have a wonderful rest of the day. And if you can't figure something out, follow Zane's advice and Google it. or throw in Chat GPT. Bye-bye.